We developed a simple tool to illustrate how risk segmentation changes depending on the relative weights of the different factors in the models you apply. We included 12 patients and 3 factors: significant medical comorbidities, hospital length of stay, and psychiatric comorbidities. On the far right are the risk rankings of the patients based on those relative weights. In the absence of a model, we initially assigned the 3 risk factors equal weights, as you can see on your screen. Patients ranked in the 1 to 4 risk range are considered high risk. Those ranked in the 9 to 12 range are considered low risk. So in the absence of a model, you can see that patients Bingham, Farnham, and Jaworski are appearing as high risk. Now let's see what happens when you apply a model. But first, please note that in a real-world situation, it's generally impractical for individuals to develop their own evidence-based models. But fortunately, there are many different research-based models available for population health risk assessment. These models often include numerous factors and complex algorithms. So let's apply Model A. Model A suggests that the single greatest risk factor is length of hospital stay, which is 4 times more important than psychiatric comorbidities. So we'll assign a 4 to hospital stay, and we'll leave psychiatric comorbidities at a 1. Hospital stay is twice as important as significant medical comorbidities, so we'll assign that a 2. You can see that now patients Bingham, Dunkirk, Farnham, and Luke are at highest risk, while patients Chu, Edwards, Herrera, and Cantor are at lowest risk. Now let's see how the risk stratification changes for different patients as you apply a different model. Model B suggests that the single greatest risk factor is significant medical comorbidities, which are 5 times more important than length of hospital stay. So we will change that to a 5, change length of stay to a 1, and in this model, psychiatric comorbidities are twice as important as length of stay, so we'll change that to a 2. Now take a look at how the risk rankings change. Which patients are now at highest risk? You'll want to take a few notes on this. Which patients are at lowest risk? Again, jot those names down. And this is the end of the brief demo of the illustration of the risk segmentation process. Thank you.